Hi, I'm Jessica DeMassa, and I'm here with the Robert Wood Johnson Foundation's Social Determinants of Health Innovation Challenge winners. And these guys came in second. This is the team from Community Resource Network. So good to have you guys here.
Thank you. It's nice to be here.
Yeah, we're happy to have you. Okay, so explain to us the Community Resource Network product and what it is.
The idea behind it is to allow communities to better understand from a social determinants, healthcare, and behavioral health perspective the whole person needs of an individual.
Okay.
And once we understand that, then we can start to organize around what are the actions we need to take and prioritize those actions so that we can help keep people out of expensive emergency department and acute care stays that may be inappropriate for them.
Okay, and I understand you helped build this, you designed it. So what does this look like? What are we talking about here? Is this a piece of software? Is this a record that has a whole bunch of things integrated into it? Give me a description of what you've designed here.
So it's actually a very visual way to communicate a lot of information. So what we realized, we talked with lots of people in the community, and that just adding more fields to a computer screen isn't the way to communicate this. So it's a very visual snapshot. So we have something called a one view, which basically in about 5 seconds can give you an idea of people's needs across the 3 domains much quicker and faster than if somebody had to pour through 10 or 12 different assessments about something. So very efficient.
All right, so talk to me about the kinds of information that is falling in these 3 domains. I mean, I think you've hit on it high level, but give us a sense of what we're really looking at here. If I look at a record for somebody and I'm looking at this one view that you've designed, what am I able to get out of it?
Well, one of the things you can quickly understand is, has this individual been in the emergency department a half dozen times in the last 6 months? Do they have an unfilled housing need? Do they have food insufficiencies? Do they have some behavioral health concerns? Those are the kinds of things and data we get from all those sources to help those who can take care of those folks better understand the whole person. And once you understand the whole person, you can then begin to sequence actions. It's kind of interesting if you're trying to help them with diabetes, but the individual is A, homeless, and B, has some food insufficiencies. Working on the diabetes is not their top priority.
Right.
So this helps prioritize what actions need to be taken and by whom.
Okay, so the by whom part I want to talk about real quick. So I understand you have this deployed already in a community in Colorado. So tell me a little bit about that. And I want to come to you then about some feedback, but I want to hear from the business side of things. How is this working? How is this helping improve outcomes for the patients? How are providers liking it? Give me a snapshot of what's going on.
Well, the easiest way to explain it is that let's just take discharge planning from a hospital as an example. Oftentimes the hospital has to plan, does the individual have appropriate housing? When the individual came into the hospital, they may have been able to fix food for themselves, but now they cannot. So we need Meals on Wheels to get organized around this. So this kind of system helps make referrals to all of those organizations, and so that we can get a close-the-loop kind of action saying, we need to have this individual taken care of, can you all take care of it? And then we communicate better.
Okay. And then what kind of feedback are you getting about the actual interface? So like you said, nobody wants to fill in more form fields. Nobody wants to sit in front of a computer and not make eye contact with a patient anymore. Right. So, I mean, give us the feedback that you've been getting.
So it's been really positive. We worked as we were designing with the providers already, but pretty much unanimously they've said it was something they had no idea what it would look like, and that it would look like that. So they're really happy with the look. And it really empowers them. You know, it makes everybody in the care team knows what the other people are doing, and we've even expanded it to include family and friends and peers, because that's very important to helping people out of crisis as well. So it's a real intuitive way as a tool to help empower all of the providers because they're the ones on the ground. They're doing the really hard work, so we're just trying to make it a little easier for them.
What's next for you guys?
Next for us is to continue the beta work that we're doing and then expand it to other communities throughout Western Colorado, the state, and the nation.
All right, we're taking over. I love it. All right, congratulations, guys, on winning the Robert Wood Johnson Foundation Challenge here on Social Determinants of Health. I'm Jessica DeMassa. Thanks so much for joining us.
Thank you.